never been in a place like West Suburban in terms of providing such 360-degree support for breastfeeding. And as a new mom myself, I'm always amazed at the expertise of the nursing staff and the lactation consultants here.
Breastfeeding is highly supported at West Suburban Hospital. It starts with women being able to go to breastfeeding classes prior to delivering their baby.
We do everything we can here at West Suburban to support and empower mothers to breastfeed their babies.
Our lactation team is fantastic, and I love to see the light in a patient's eyes when they finally achieve lactation because they've been supported by our great team here. And it's just such a gift we're giving that patient and the future health of that baby.
Thea was born here in West Suburban Medical Center 6 months ago approximately. We had a great experience here. We gave birth using the midwives from Oak Park who helped us give birth in the Alternative Birthing Center.
Right from the delivery room, we encourage them for skin-to-skin contact and followed by trying to breastfeed in the delivery room itself.
We will deliver the baby directly onto the mother's abdomen and onto her chest, which is a very important part of early breastfeeding experience because that skin-to-skin experience allows the baby to truly nuzzle the mother and initiate the early response that is needed to begin breast milk production. The nursing staff is extremely supportive, does not remove the baby from the mother to do any procedures. The baby is allowed to transition through delayed cord clamping on the mother's chest, and some babies will initiate breastfeeding immediately.
We had some complications though, and after her birth, Thea spent 4 days in the nursery here on the ward, and we got excellent care there as well. Because of the complications, breastfeeding was particularly difficult.
If they have to come to the nursery, we encourage them to be in close contact with our lactation consultants.
The nursing staff make it a priority after birth to make sure that the baby is breastfeeding, the midwives as well. We don't leave the room or the hospital until that baby has initiated breastfeeding.
As we have the postpartum breastfeeding class, and if moms can't make the class, I bring the class to their room and to their bedside. And I use my little Lulu bear here to help show positions and teach how to breastfeed right at their bedside.
I went to 2 breastfeeding classes. They were on the ward, so when Thea was born she was in the nursery and we actually weren't able to feed straight away. So she had a nasogastric tube and an oral gastric tube, and the team in the hospital were very supportive in that. They made sure that my colostrum or anything that I pumped was fed to her, so there was never any formula pushed at us, and I was shown how to use a pump, which was my first time doing that in the postpartum haze a few days after giving birth. And I got a lot of support from the lactation consultant on the ward who helped me with getting the first latch. We had very poor latch at first, and we got nipple shields and all sorts of stuff, and then after we went home and continued to work on breastfeeding, I came to the support group here several times, and I really found it very helpful, and we made it through the more difficult parts, and I'm very happy with how it's going now.